Good afternoon, everyone. My name is Keith Johnson. I am with Caregivers Alberta, and I will be your host for today's Lunch and Learn. Thank you for joining us today. Before we get started, I do have a quick land acknowledgement and then a few housekeeping pieces, and then we'll introduce our topic for the lunch hour, Lunch and Learn, and kick it off. So thank you, everyone, for being here today. Really appreciate you taking time out of your lunch to join us. At Caregivers Alberta, we acknowledge the traditional and ancestral territories of Treaties 4, 6, 7, 8, and 10, namely the Blackfoot Confederacy, Kainai, Piikani, Siksika, the Cree, Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, Tsuut'ina, Inuit, and Métis. We acknowledge as an act of reconciliation the many First Nations, Métis, and Inuit who are visiting or residing in these territories, and many other peoples, First Peoples of Canada, whose histories, languages, and cultures continue to enrich our vibrant community. Caregivers Alberta acknowledges these traditional lands upon which we live, work, and thrive. We recognize that all Albertans are treaty people, and it's our responsibility to pursue a deeper understanding of the meaning of the friendship treaties so we can honor and respect the perspective view of Indigenous people and continue to learn our shared histories. We also acknowledge the harms and mistakes of the past and invite all to consider how we can each, in our own way, try to move forward in a spirit of reconciliation, in particular as we strive to offer supports to many First Nations, Métis, and Inuit caregivers through respectful, collaborative efforts. For today's webinar, if you have any questions, the webinar chat is enabled, so you can enter your questions into that chat, and our speakers will be happy to answer them, or myself, Keith Johnson. I do also have a colleague on that you may see on the screen, Darren, who is our technical guru support supervisor today. Will also be answering questions and any issues that come up. So today's webinar topic is on brain basics for caregivers of those with acquired brain injury. So this education session aims to provide caregivers with some essential knowledge about brain injuries and their impact. This session features two exciting and excellent speakers, Shayna Scarpino and Ewa. Hopefully I've said those names right. If not, my sincere apologies. Shayna holds a master's in counseling and psychology from the City University of Seattle and works as a support facilitator at the Brain Injury Center. She leads groups and creates supportive environment for individuals with acquired brain injuries. Ewa is a service coordinator at Brains Care Center as well, and she's dedicated to helping clients regain independence and rebuild their lives after brain injuries. Her passion lies in making a meaningful impact on those who are affected by ABI. So thank you for our speakers for being here today. So I'm excited to welcome both of them here. And I'm going to turn over to, I think, Shayna first, who's going to kick us off and with the presentation. So thank you very much. Over to you, Shayna.
Awesome. Thank you for that introduction, and thank you everybody for being here. I do have some slides that we are going to share, so I'm just going to set that up quickly. I assume everybody, well, we're good. You can see my screen. Yeah.
Yes,
Okay.
we can see your slides.
Sweet. Thanks. So yeah, thank you all again for being here. We are going to be talking about brain basics for caregivers for those with acquired brain injury. Again, my name is Shayna and I'm joined by Ewa. So I'll start us off with just some stuff about what we're going to be talking about. This is going to be quite informed, so of course questions are welcome. We have an agenda with invisible injury, causes of brain injury, limitations after brain injury, behaviors and misconceptions, brain injury versus degenerative disorders, impact of brain injury across the ages, recovery trajectory, and caregiver changes in particular, and then just some resources is a little bit about Brain Care Center. But otherwise, yeah. So to start us off, we like to bring this up first because especially as a caregiver, you may find, yourself supporting someone whose brain injury isn't immediately visible to others. So it's not like a broken bone or a physical disability. Brain injuries often don't come with obvious signs. And so if you look at this group of people, would you be able to tell who has a brain injury? Many people, many individuals with brain injury, recover physically, whether this leads to others assume they've returned to their old normal. Although they may still face ongoing challenges such as memory, concentration, emotional regulation, fatigue, or other cognitive difficulties as well. So things that aren't always apparent, but they are significantly impacting their daily lives. And so think about how we naturally will offer someone help when we see someone using crutches or in a wheelchair, whether we're holding the door open or allowing them to go first in line for something. When somebody has challenges that aren't visible, or sorry, that they are visible, these or they aren't visible, these same instincts don't kick in. So even, close family friends, close family members, they may misunderstand behaviors, expecting things to be back to normal rather than recognizing the need for continued support. Because, of course, people with brain injuries, they still need accommodations. Those accommodations and needs will vary from person to person. And so having that, conversation, learning about brain injuries in general, can hopefully help in being more informed, and being able to support somebody with a brain injury. So these are just some examples of causes of brain injuries. So there's traumatic brain injuries on one hand, and so these are typically like hits or blows to the head. So whether this is from a car accident, people can trip, they fall, especially in in Edmonton weather, gets a little cold, so people can slip often. Falling objects have come up, even violence or even assaults too can cause traumatic brain injuries. Non-traumatic ones include strokes, aneurysms, bacterial infections, oxygen deprivation to the brain. So this can actually be caused by like things like drowning, cardiac arrest, and things like that too. So understanding these can help people recognize even risk factors, seek early interventions, and hopefully provide more informed support to those with brain injuries. So we like to talk about a spectrum. So brain injury refers to brain damage occurring after birth. So this is not related to congenital or degenerative conditions. Brain injury ranges from mild to severe, with each level affecting people differently. So a mild brain injury, for instance, such as a concussion, or it's also called a mild traumatic brain injury, is caused by a blow to the head or sudden movement of the brain inside the skull. It doesn't show structural damage on a CT or MRI scans, but it can still disrupt brain function, which can lead to symptoms like headaches, memory issues, and even emotional changes. Diagnosing a mild traumatic brain injury like a concussion can be very difficult. It actually relies on self-reported symptoms. Moderate to severe brain injury includes what we kind of talked about the last slide. So strokes, brain tumors, severe trauma, more severe blows to the head or hits to the head, like traumatic brain injuries. And these injuries will often result in long-term impairments. So this could include mobility issues or cognitive difficulties, and it actually may require very extensive rehabilitation processes. So while mild injuries, they say are less threatening or life-threatening, sorry, they all can have lasting effects on the brain and daily life too. So it can be a big thing. So some factors that affect outcome. So the outcome of a brain injury is influenced by several factors, that affect recovery, independence, quality of life. Age is a pretty important one. So younger individuals tend to recover more effectively due to the brain plasticity, while older individuals may experience slower healing and more lasting effects. Medical attention. This includes early intervention, rehabilitation plays an important role in recovery too. A strong support system, family, friends, caregivers can also help impact emotional well-being and the rehabilitation progress. The environment following an injury, so such as access to rehabilitation services, a stable living situation can also significantly affect recovery. A person's pre-injury health, so this includes, cognitive abilities, pre-existing conditions, can influence the healing process too. The severity and location of the injury can help determine the extent of physical, cognitive, and emotional impairments. So as I said before, no brain injury is the same. Everybody is quite different, depending on where the injury occurred. Mental health is a big one too. So things like depression, anxiety, these factors can also hinder motivation, hinder recovery, as can substance abuse as well. So this can also complicate treatment and rehabilitation efforts too. Overall, brain injury recovery, like I said, is very highly individualized. These factors play a very important role in shaping outcomes. So understanding that these different factors can affect the outcome can hopefully even create more informed decisions and knowledge about the brain injuries as well. So we'll talk briefly about some of the limitations that occur after brain injury. So for instance, I have some common ones that are on the slide here, but it is important to still be aware, that various limitations may affect daily life. So they also can depend on the severity and location of the injury. But for one, there's physical changes. So this can include fatigue, mobility challenges, balance difficulties. Another one is perceptual changes. So whether this is visual, spatial impairment, there's a right or left neglect in the brain, sensitivity to screens. I would say sensory sensitivity in general too. So that is a common one too. Cognitive changes, so executive functioning, insight, judgment, attention, memory is a common one as well. Communication changes, so this includes expressive or receptive language problems, speech and voice difficulties. There's some clients will develop aphasia, so challenges in speech, and emotional changes, so challenges like depression, anxiety, socialization difficulties, emotional lability, so it's very emotionally up and down. There's no regulation in their emotions is essentially what that is. So emotional dysregulation, and things like that. So we'll get into that a little bit in the next few slides, but those are just the general changes. So getting deeper into each one briefly. So individuals with brain injuries can often experience a range of physical changes, that can impact their mobility, sensory perception, and their well-being. One of them includes paralysis. So this may occur on one or both sides of the body due to motor control damage. Per pares- Paresthesia, can cause abnormal sensations like tingling, numbness. Spasticity leads to muscle stiffness and involuntary spasms. This affects their movement. Balance issues is common, so this can increase risk of falls due to impaired coordination. This also vision problems may include blurriness, double vision, taste and smell, can distort or reduce sensory perception. There's pain and headaches are common, resulting from, nerve damage or brain activity changes. Some individuals will develop seizures, and this is caused by abnormal brain electrical activity. There's also sleep and fatigue challenges as well that are quite common. So the brain, after it's injured, can disrupt sleep cycles and energy regulation. So this can lead to exhaustion and sleep challenges too. Perceptual changes can significantly impact daily functioning and quality of life. So neglect of one side of the body or environment, occurs when an individual fails to recognize or respond to stimuli on one side. This is often affected by brain damage, such as like a stroke, which can also lead to trouble understanding spatial relationships. They may manifest as difficulty judging distances, navigating spaces, recognizing object positioning, leading to challenges with movement and coordination. Impaired body awareness and distance judgment. So this can result in clumsiness, difficulty reaching for objects, misjudging personal space. There is a heightened sensitivity to light, touch, sound, or taste. So again, the sensory sensitivity, which can lead to discomfort, distress. It's challenging to be able to tolerate sensory input, which again can impact daily life and even social interactions too. So for cognitive changes, these can affect thinking, problem solving, and daily functioning. So planning and organizing difficulties may, make it hard to set goals, manage tasks, follow through with steps in a process. Initiation challenges can cause a lack of motivation or difficulty starting activities without being prompted or like told how to do something or what to do. Orientation may result in confusion about their time, the place, the situation. Attention and concentration can make it difficult to focus, process information, or switch between tasks. I find that this one is quite common as well. Memory, so again, another common one. This actually affects short-term recall, so learning new information, retrieving past memories, and things like that. Insight can reduce awareness of one's own difficulties, making self-monitoring and adaptation more challenging as well. So, yeah, cognitive changes are common after a brain injury. And it's can be hard to really pinpoint on certain things, but being able to kind of break it down and, learn different factors is helpful too. So communication changes. So again, these can affect the person's ability to express and understand language. This may mean language impairment, so this may cause difficulty finding words, forming sentences, understanding spoken or written communication. Speech difficulties can result in an unclear or slowed speech due to muscle weakness or coordination issues. Aphasia is a language disorder that affects speaking, understanding, reading, or writing, often caused by damage to language processing areas of the brain. Apraxia is a motor planning disorder where individuals struggle to coordinate the movements needed for speech, despite knowing what they want to say. Dysarthria involves slurred or mumbled speech due to weakened or impaired control of the muscles used for speaking as well. So these are just some examples of communication changes that could come up. When we think about emotional changes, these can affect mood regulation, behavior, and even their personality. So identity changes may occur as individuals struggle with shifts in abilities, roles, and self-perception. Emotional lability. So this causes rapid and intense mood swings. This is often with difficulty controlling emotional responses. Impulsivity and disinhibition can lead to saying or doing things without considering consequences, which can affect social interactions. Emotional flattening results in reduced emotional expression, making a person appear indifferent or unresponsive. Inflexibility may cause difficulty adapting to change or considering different perspectives. And increased frustration and lowered tolerance can lead to irritability, difficulty managing stress, and a shorter temper in challenging situations as well. So, yeah, that's an overlook, but it was going to take over for the next slide, and then some of the emotional stuff will come up too and start to make sense if there are things that you find that the person maybe you're caring for or the person that starts to exhibit, then maybe it'll start to think and make sense. But anyways, I'll let Ewa take over.
Thanks, Shayna. And I saw a comment in the chat just asking if the slides are going to be available. We definitely can send them over to caregivers about her, and I'm sure they'll be able to distribute it afterwards. So just speaking briefly about behaviors and misconceptions, brain injuries can cause personality changes that may be misunderstood by others. Disinhibition and impulsiveness can make individuals seem rude, immature, or aggressive, even when their actions are unintentional. We see things like egocentric behaviors, which may appear as insensitive or selfishness, although it often stems from a difficulty understanding others' perspectives. Emotional lability, it can lead to exaggerated emotional responses that seem overreactive or superficial. We see lowered drive and poor motivation, and this is quite common, which can be mistaken for laziness, even when in reality they result from brain injury-related changes. Restlessness and agitation can cause individuals to feel and to seem anxious or unsettled. Reduced social skills may make someone appear difficult or inappropriate as they struggle with communications, boundaries, or emotional regulations in social settings. Next slide, please. Next slide, Shayna.
Yeah, I clicked the next slide. It doesn't seem to be moving though. Oh, there we go.
And so brain injury can be categorized as acquired brain injury or degenerative disorders, each with distinct characteristics. Now, ABI or acquired brain injury occurs suddenly due to an external event, and Shayna spoke about this earlier. Events like a traumatic brain injury, like a stroke or infection, while with degenerative disorders, examples, dementia, Parkinson's, Alzheimer's, ALS, it develops gradually over time, and it's due to internal brain deterioration. With acquired brain injury, the progression varies with a potential improvement through rehabilitation, whereas with degenerative disorders, it worsens over time with no cure, unfortunately. Memory impacts in acquired brain injuries may cause retrieval difficulties, but isn't always progressive. While with a degenerative disorder, it can lead to continuous memory decline. Recovery potential is possible for people who have suffered an acquired brain injury through therapy and neuroplasticity, but with a degenerative disorder, there's no recovery. and then focusing on, symptom management is what's best. Treatment for acquired brain injury emphasizes rehabilitation and adaptation, whereas degenerative disorders, the treatment aims to slow progression and support caregivers. Next slide. The impact of acquired brain injury varies across different age groups, and we're just going to run through the different age groups quickly. In children, acquired brain injury can interfere with the brain development, leading to long-term learning disabilities or difficulties. We would see delays in social and emotional growth and challenges in acquiring new skills. These effects may come and they may become more noticeable as they age and face increasing cognitive demands. In young adults, acquired brain injuries can disrupt their career paths, education, relationships, and independence. They face challenges with memory, problem solving, emotional regulations, and it may affect employment, social interactions, and it often leads to frustrations and identity struggles. In older adults, acquired brain injury is often mistaken for dementia, and it makes diagnosis and treatment more complex. In older adults, recovery may be slower due to age-related factors and the impact on mobility, cognition, and independence. It can be more pronounced. Next slide, please. Recovery, the trajectory. So this just describes the trajectory of recovery with an acquired brain injury. And recovery after a brain injury often begins with a rapid and noticeable improvement, especially in the early stages. As a caregiver, you may witness remarkable changes. For instance, someone going from a coma to recovering movement or speech. This phase is called a spontaneous recovery, and it's most pronounced within the first year after the injury and can bring a sense of hope and relief. However, recovery doesn't stop after this initial period, even though progress may slow down. This slower pace can be discouraging, and it's natural to feel worried and to feel like your loved one's progress has plateaued. But it's important to remember that slow progress is still progress. Every small improvement, no matter how minor it seems, represents another step forward in their journey. Next slide, please. Now, caring for someone with an acquired brain injury can lead to significant life changes for caregivers. It can lead to increased stress and responsibilities as they manage medical needs, daily care, and emotional support. Can cause reduced social life due to time constraints and caregiving demands, leading to isolation. It can cause health concerns and uncertainty about the future as caregivers worry about long-term care needs and their loved ones' progress. It can cause changes in future plans as career goals, travel, or retirement may be altered to accommodate caregiving. Can lead to a loss of support and companionship, especially if the injured person's personality or abilities have changed. Financial difficulties due to medical costs, reduced work hours, or lost income. And it can cause less time for family and friends as caregiving takes priority, impacting personal relationships and self-care. And I imagine that there are even more things, more changes that caregivers experience which are not listed here. Next slide, please. Caregivers often experience grief, loss, and ambiguous loss. And these are common experiences following an acquired brain injury as the loved ones navigate profound changes. Ambiguous loss just occur, it speaks about when the person is physically present, but cognitively or emotionally different, making it difficult to process grief. Grieving the loss of who they were before the injury can be painful for both the individual and their caregivers, as abilities, personalities, and relationships may change. Emotional challenges, including frustration, sadness, and uncertainty, affects both the person with an acquired brain injury and their support system or their caregivers. The emotional toll of caregiving can lead to stress, burnout, and prolonged grief, especially when uncertain recovery outcomes are present. Role changes may shift a spouse or parent or friend into a caregiving role, altering relationship dynamics. Self-care, support groups, and professional help are essential in coping with these changes, ensuring both the caregiver and the individual receive emotional and psychological support. Next slide, please. Caregiving for someone with an acquired brain injury can evoke a wide range of emotional responses. Acknowledging and addressing these feelings is essential for maintaining the caregiver's well-being and resilience. And some of these feelings and emotions may include denial. Caregivers may initially struggle to accept the changes in their loved one, holding on to hope for recovery or avoiding the reality of the situation. It can cause fear and anxiety, causing worries about the future and the person's condition, and the abilities to handle caregiving responsibilities can create constant stress, anger, and resentment, and this happens quite often. Caregivers may feel angry about the injury, the changes in their life, or the emotional toll of caregiving. They may experience resentment towards the lack of support or perceived unfairness, guilt, feeling guilty for not doing enough, for being frustrated, or for, just taking time for themselves can weigh heavily on caregivers. Grief. There is often a mourning process for a person they once knew, the lives they had, or the future they envisioned. And depression. The emotional and physical strain of caregiving can lead to feeling of hopelessness, sadness, and a sense of being overwhelmed. Next slide, please. Caregiver self-care. It is crucial for maintaining physical, emotional, and mental well-being while providing support to a loved one with an acquired brain injury. Without proper self-care, caregivers can experience burnout, stress, and emotional exhaustion, which can negatively impact both their health and their ability to care for their loved one. Prioritizing self-care helps maintain resilience and strength, allowing caregivers to continue to support their loved ones in a sustainable way. Some of the key aspects of self-care for caregivers include physical health. We encourage regular exercise, sleep, and healthy eating. to help boost energy, reduce stress, and improve overall well-being. Emotional health. Managing stress through relaxation techniques, hobbies, or activities that bring out joy can reduce the feeling of burnout and anxiety. Social support is important. So connecting with friends, family, or support groups, it helps caregivers to feel understood and less isolated, and provides a space for emotional expression. Boundaries, setting limits on caregiving responsibilities, and asking for help when needed prevents overexertion and ensures caregivers have the time for themselves. And seeking professional help through counseling or therapy provides an outlet for processing emotions like grief, anger, or guilt, and aids in managing the emotional challenges of caregiving. By engaging in self-care practices, caregivers can protect their mental and physical health while staying emotionally available for their loved one. Next slide, please. At Brain Care Center, caregivers of individuals with moderate to severe brain injury have access to a support group where members can support each other as they reflect on their challenges and successes after someone they cared for sustains a brain injury. Caregivers can also access one-on-one counseling services to learn effective coping strategies. And this service is open to caregivers of individuals with mild to severe brain injury. To be eligible for our caregiving services, the caregiver must be providing support to an individual with an acquired brain injury. The brain injured person does not need to be a client of ours at Brain Care Center. We do have a referral form which needs to be completed, and the form is located on our website. No medical documentation is required for a caregiver to access services, and the caregiver must also live within our service regions. Next slide, please. Thank you so much for your time and attention, and we will just take the next couple of minutes to take on questions. Yeah. Or if Shayna has any other thing to add.
I did just want to pass it back to those at Caregivers Alberta if there's any support resources and things that you typically talk about, but otherwise, yeah, we're done with our presentation.
Great. Thank you very much, Shayna and Ewa. Folks, if anybody on the line has any questions, please type them into the chat. We'll be happy to ask them of these two lovely ladies. And thank you again for your presentation. I do have a question for your referral form. So I'm actually looking at it right now. I'm going to post it in the chat for folks. Does it have to be a medical or professional doctor making that referral, or can it come from, a family member or from the caregiver themselves?
It can come from the caregiver themselves, for sure. Yeah, there's a self-referral form on our website. They just have to be a caregiver for somebody with a brain injury, like an acquired brain injury, I guess.
Great.
So, yeah.
We do have a question here from Doug Takark. Thank you for your presentation. Are individuals living with acquired brain injury eligible for PDD funding, either with a caregiver provider or family managed support?
PDD. Is it okay if you remind me what?
Pervasive developmental disability.
Okay. Ewa? do you know about more funding things? I know there are some other options for funding, such as AISH, CPPD, and additional ones. I don't know. It was a service coordinator, so.
Yeah, you're right, Sheena. We typically have clients who are receiving several forms of funding, and we don't really kind of, we don't really interfere with that. So whatever form of funding the client comes with is accepted. So if, the person with the brain injury is able to receive the PDD funding, sure, why not? Typically we have clients who receive funding from AISH, from the government, and just any form really, we accept it.
Blaine Kenneth is asking, is PDD same as PWD? I can quickly answer that. PDD is pervasive developmental disability. It's typically what we're talking, autism, those type of developmental disabilities in that spectrum. And PWD is person with disability, which is, first person language covering all disabilities when we're talking about disabilities. Any other questions, folks? Please feel free to type in. We'll give it a minute. You're welcome, Blaine. I do have one other question from my lens, because I always like to ask questions. So you offer support groups. Can you talk a little about what that support group's about? How do people, what do people get out of that support group, and what's the main goal of that support type group service?
Yeah. Ewa, do you want to start that off?
Yeah, I think one of the major benefits of the support group is for caregivers to have a sense of community, to know that they are not alone in their struggles, and to have like a platform where they can share without any judgment. There's a lot of advice, a lot of, help that is rendered during the support group, and we have caregivers who have been participating for a long time, and it has been greatly beneficial so far.
Yeah, exactly. It's a way for them to still come together because as, we kind of talked about in our presentation, sometimes, caregiving can even lead to loneliness, isolation, and it's difficult. The brain, I mean, we are definitely not professionals of the brain either, but there's lots of information, lots of new things coming up regarding the brain. And so a support group is a really good way for caregivers to come together, as Ewa said, bring the community, share experiences, share strategies, and get different perspectives, right? So we have some caregivers that whether, they're caring for a spouse, a child, a parent, they come together and talk about their experiences, share, be people again, I guess. So yeah.
Great, thank you.
Mhm.
For those on the webinar, I did put a link into the chat for Brain Care Center's services. I didn't put the whole website. I went straight to the services because if, as a caregiver, you're looking for supports, straight to the services. And in there you'll find, what we've just talked about, some of the support groups, the referral aspects. So thank you. Any other questions from the line? Oh, Darren has his hand up, but his camera off.
I've got a more technical question. I'm just wondering if it's known why the recovery rate during the spontaneous recovery period is as rapid as it is. Is it mostly because of like the body taking care of itself, the lymphatic system cleaning things out, swelling decreasing in the brain, or is there other things going on at the same time?
This is a very, technical question. I would say there's probably a variety of different factors. And I know at the beginning we talked about different factors that can affect the outcome too. So whether it's, supports, rehabilitation supports, support systems, even access. So I know depending where the person might be in Alberta, for instance, maybe they don't have as much access to like hospitals or different rehabilitation processes. So I would say like I don't really know if there's a complete answer to that. I think there's a lot of different factors that can play into
Mhm.
it.
Yeah.
It's just typically right off the bat, it can be very spontaneous, but through time, it kind of slows down. But
Mhm.
yeah.
Yeah,
I would
so, and
also
also
say,
other health conditions can cause can
Yeah.
affect your cognition as well. So as other healing happens, that might, yeah. Anyway, that's just where my mind went.
Yeah.
Thank
And
you.
I guess,
another
oh,
factor, I'm sorry, I was just gonna say another factor in that, and sorry, my old work life and research is that you mentioned about neuroplasticity, neuro rehab. Those also impact, the brain's ability to adapt to the
mhm.
acquired brain injury as well. So those have factors in terms of healing perspective as well as
Mhm.
ability to recover.
Yeah. Yeah, absolutely. And I guess we didn't talk about neuroplasticity, but essentially creating those new pathways in the brain,
Yeah.
right? Sometimes it can take time. I always like to provide the example of taking your route to work or somewhere that you typically go often. You take a certain way, it's just becomes natural to you, right? And then all of a sudden there's construction and you have to take a different way, and then your brain has to try to learn a different way to get there. You're on Google Maps and things like that. So that basically is neuroplasticity as well, creating those new pathways, which is difficult. So imagine trying to find a new route to work last minute. So, and then,
I had some uh uh neurology training, oh, over 20 years ago now, and it's just great to hear that so much has been learned about brain plasticity, and that there's still brain growth that happens all throughout the lifespan. It's not something that is only accessible to people who are young, which is what they thought, 30 years ago.
mhm, absolutely.
Mhm.
So I'm going to end with one last question, then I'll wrap things up.
Sure.
So from your perspective, we have a number of caregivers on the line. What from your perspective would be like the number one thing, realizing that all like acquired brain injury is different and how each individual experiences what they go can be different. What's the number one piece of advice you give a caregiver who's supporting someone with acquired brain injury, and what supports do you think they should seek or support to help them along that journey?
Mhm. Let Ewa start that off.
That's a really heavy question.
Sorry.
If I am to give the caregiver an advice, I would say be kind to yourself. I find that caregivers often they don't extend the same level of empathy, kindness, and love that they give out to others to themselves. And it's important. It's important for your mental well-being, it's important for your physical well-being, it's important for your motivation that you are able to look in the mirror and still love yourself, show yourself kindness, and believe that you're doing a great job, which I'm sure you are. And so, that's just what I would say, and I mean it, honestly.
Mhm. Absolutely. Yeah, definitely being kind to yourself. This is it's difficult. It is really hard. Somebody with a brain injury, of course it happens to them, but it happens to there are challenges within the system with the people that are around them too. So we recognize that it is hard for the family, for the people around, the friends. So yeah, being kind to yourself. You are important too. You deserve to take care of yourself as well. However that might look like for you. And yeah, so
Great.
I guess tips. Community, I think is a big one. Self-care, talking to somebody about it, talking to whoever that might be, even a friend, family member, that can understand, counselor if you want to go more professional, things like that. So, mhm.
We do have one last question in the chat. Again, this is from Doug. Are you Edmonton-based with services available across the province virtually or in person?
We are Edmonton-based, yes. We help Edmonton, Edson, Drayton Valley. Ewa, do you know our specific region?
I think that's about sums it up, those three.
Mm-hmm.
The website also mentions Hinton and Jasper.
Yes, thank you. Yeah.
Yeah.
Yeah. So we go as far as Jasper, whichever one's farther. I think it's Jasper. And yeah, we do virtual for caregivers in particular, we do virtual support groups. And then with like counseling, that's either in person or virtual. So
Thank you. Thank you again, Shayna and Ewa, for coming today to present and speak to our caregivers and folks on the line about, the work you folks do and talk about brain injury, acquired brain injury today. Just a reminder to everyone here that, the Brain Care Center, along with Caregivers Alberta, is there to support you along your journey. So we both offer services that, can support you, and, we're happy to connect you into each other's services as needed to support you along that journey. Quick reminder, Darren, I do not have it in front of me, but our next Lunch and Learn is what date?
Not in front of me either.
Could
One
I
quick.
ask you before?
It is coming up not too long. Let's see here. We've got our Meet the Author with Carol McLean on March 13th. And we have our Heart Math for Caregivers Take a Break on March 18th. And our next Lunch and Learn is Tax Season for Caregivers on April 8th.
Well, the next Lunch Learn is a very riveting one. Tax season, tax information, which is just
It's always a popular one.
always popular.
The rules change every year.
Yes. So would encourage you all to tune into that. As we end today, I'm going to quickly place in our chat for everyone our Eventbrite listing, which shows all of our events coming up for Caregivers Alberta over the next little while. Would encourage you to check that out, as well as check out the Brain Care Center's website for supports, as well as you navigate supporting your care recipient or care partner with an acquired brain injury. So thank you everyone again today for attending. Thank you to our speakers for doing an excellent presentation. Hope you all have a great day. And for those who attended in Alberta, I'm sorry to say snow is coming again. My apologies. It's not our fault. But hopefully nice weather will come soon and we can all start to enjoy the weather once it clears up. So again, thank you everyone. Have a great day. Enjoy the rest of your day, and thank you for attending our Lunch and Learn today.